and welcome back to Reclaiming Fertility Joy, Healing the Broken Spirit of Polycystic Ovarian Syndrome. I am your host, Corey Ray Kovacs, registered nurse and women's wellness coach and mentor. And I am so excited for the guest that we have today. This is Dr. Kalea Wattles. We have bonded so much recently over farm animals and all things fertility and women's health. So I'm really excited to introduce you to her. She is a naturopathic physician and functional medicine practitioner specializing in fertility. As an educator, podcaster, speaker, and leading expert in functional fertility, Dr. Wattles combines her extensive knowledge of naturopathic and functional medicine to support patients throughout their fertility journey. Dr. Wattles is passionate about empowering women with fertility education, ensuring that they have the information they need to plan for the future of their dreams. Welcome to the show, Dr. Wattles. So happy to have you.
Thank you so much, Corey. I'm so happy to be with you.
I was really excited when I started putting this summit together, and I just was kind of calling out to the universe who, bring me the people, bring me the energy for our listeners, because there's so much information out there, and I knew that the right people were going to come. And as soon as I came across your profile and just saw you speak in your podcast, and then at the moment that we spoke, I knew that you have an important mission and such a vital role in this fertility space. And I, for one, am so grateful that you are here.
Yeah, well, I think it's a real honor to be able to take all of these different modalities, like we've talked about naturopathic medicine, functional medicine, my own experience as a mother, and channel that into helping other women succeed and really build this family that they're longing for. So I'm honored to share that message. And it's just such a blessing to have a platform to spread this news.
Yeah, absolutely. And we know, with women with polycystic ovarian syndrome, I mean, that we're starting to see more and more, come out. And we certainly know that it's one of the leading causes of infertility, particularly in the United States. And so bringing this awareness to others that, hey, you know what, there is a lot of things that we can do to help improve our health, improve our overall quality of life, as well as our fertility, and that there's not this lost hope. So I would love to for you to kind of just give us this brief explanation of, like, what's the difference between what you do as a naturopathic doctor and functional medicine practitioner compared to a conventional allopathic doctor or modality.
Sure. Yeah. So as a naturopathic doctor, I'm trained in all of the basic and biomedical sciences, just like your MD would be. So I am licensed as a primary care doctor. I understand how to diagnose, how to do imaging and order labs and write prescriptions and all of the things that you would expect from your primary care doctor. In addition, I'm also trained in botanical medicine, physical medicine, lifestyle medicine, nutrition. So my training as a naturopathic doctor really gives me all of the tools I need to approach someone from a whole person perspective, looking at all of your body systems, looking at your modifiable lifestyle factors, and then also things like your social determinants of health, which we know are so important and have such a crucial role to play in our health trajectory. So naturopathic medicine it's patient-centered, it's holistic, it really helps to cultivate health from the ground up. Then I have my postdoctoral training in functional medicine. So I'm certified by the Institute for Functional Medicine. And functional medicine, I describe it as an operating system. It's really a roadmap that helps me to approach complex cases in a way that will address all of our body systems. PCOS is a perfect example because we know that this is actually a multi-system condition, right? And we can talk about that oftentimes PCOS is categorized as like a reproductive health issue, but we know it's so much more than that. So my functional medicine training helps me to look at a patient's history, the timeline of their life, their diagnoses, their lab results, their history, everything about them, and create a map of their body systems. So I'll just give you a really brief overview of what that means in the functional medicine model. That means we're looking at your assimilation, which is essentially your digestion and the way that you take nutrients in and then put them to use in your body. We're looking at defense and repair, which is your inflammatory mechanisms and your immune system. Your energy, so that's your mitochondria, the way that your cells make energy to do energetically expensive processes like ovulation, like implantation and fertilization. We're looking at biotransformation and elimination. So that's the way that your body engages with environmental toxins and processes them and eliminates them. We're looking at your transport node, which is oftentimes your circulation, the way that your cardiovascular and lymphatic system works. We're looking at your communication mechanisms, that's your hormones and your neurotransmitters. And then we're looking at the structural integrity of your body. So that's big structures like your skeleton, all the way down to tiny structures like your cellular membranes. So as you can see, we're thinking about every system, every tissue type, every process in the body. And that's really what sets naturopathic and functional medicine apart and allows us to shine.
The amazing thing is that this is a, you know, when you're building your healthcare team, it really is about a team aspect and looking at it, because there's so many different specialties and how those play a role. And so you wouldn't go to an auto body shop to buy a dress, right? So
Yes.
it's kind of like that. So it's understanding that there are different places for our care. And sometimes in this culture, we go through the primary care or the specialist route, particularly in fertility with OBGYNs or REIs, and don't realize that there's other aspects of here that could be supporting our health in different ways. And so it's really important for us to figure out what is in, how is my health and how can I support my health the best. So
Absolutely.
it's really great to hear that that you've kind of combined and made this really special kind of niche that addresses both functional, how the whole body works, and applies that to fertility. So
Yeah.
given with PCOS specifically, what is the first thing that you do when you recommend, when you see a woman with PCOS who's trying to conceive? Where's kind of a starting point for you and that particular patient?
Yeah. So what I like to do, kind of going back to this body systems approach, is I'm going to collect some labs. I'm going to take some history, do some physical examination, and we really need to figure out which body system in this patient needs the most support. So PCOS is all about uncovering the root cause for that patient. And it's different for everyone. It looks different for everyone. So first of all, I like to do a very thorough laboratory investigation, because this helps me to create a hierarchy of, which systems need most support and what are the underlying drivers for this person. So I'm definitely going to be looking at hormones. I like to do a hormonal blood draw on cycle day 3. That really helps me to assess things like ovarian reserve. So on cycle day 3, I'll look at a follicle stimulating hormone, a luteinizing hormone, an estradiol, and an anti-Müllerian hormone. Now, there's other hormones I just end up adding on to that. They're not cycle day 3 specific, but we're already getting our blood drawn, so we're going to look at some other ones. So for me, I'm going to also look at prolactin and DHEA sulfate, a whole testosterone panel, so free testosterone, bound testosterone, sex hormone binding globulin. I'm going to do a fasting insulin. We know that insulin resistance is a really powerful driver of PCOS, and we can talk more about that. But I want to look at a fasting insulin so I can see to what degree is this patient's metabolic health something that I need to prioritize right away. We're also going to look at a comprehensive metabolic panel so I can see a fasting glucose, I can see liver enzymes. We're going to do a CBC looking at our red and white blood cells. I'm going to do a full thyroid panel. So for me, that's a thyroid stimulating hormone. I want to see, not only how the thyroid is talking, how the brain is talking to the thyroid, which is a thyroid stimulating hormone, but I want to see how the thyroid is responding. So I'm going to look at a free T3 and a free T4. Those are our free thyroid hormones.
Right.
I also want to look at thyroid antibodies. We know that there's a lot of overlap in women who have PCOS and who have autoimmune thyroid disease. So I'm going to look at thyroid antibodies, and then also something called reverse T3, which kind of tells me if your body is under stress and if it's prioritizing your thyroid hormone. So I'm going to do a full thyroid panel. And then something else that is really, really important for me in people with PCOS is to do a lipid panel. We know that the
Mhm.
insulin resistance and the metabolic dysfunction can affect our lipids. So I'm going to do a full lipid panel. And then I'm also going to do my favorite inflammatory marker, something called high sensitivity C-reactive protein, or
Mhm.
HSCRP. We know that inflammation is a big time mediator of PCOS symptoms. So as you can see, I'm doing a big old lab panel, and that's really going to help to guide and add precision and specificity to my treatment plan.
This is one of those things that is, kind of different in terms of where you get when you kind of go a traditional route versus going a functional medicine or naturopathic route is this labs. You might
Yeah.
have basics, and I remember when I went through my fertility treatment, there were basic labs and things like that, but there wasn't, nobody took a look at my insulin, nobody took a look at my DHAES, and nobody took a look at my C-reactive proteins, and so it's, and even now I've had to advocate for myself to get
Yeah.
these labs and understand that that is how that's how you make a unique individual blueprint, because PCOS is different for everybody, every single person.
Absolutely.
And because we have this genetic verse and environment, and we all grow up differently, we all grow up in different houses, we all have gone through different stuff in our lives, and stress and lifestyles and cultural social factors in that as well. And so you have to take all of that in consideration, and you can't do that if you don't have the basic information, which are the tests. So that being as a
Absolutely.
first step is huge in really getting to the place that you want to be. Which, I mean, I think for everybody coming through here is fertility. They have this focus on fertility, but really this is a multi-system, and so getting that picture is so important. You
Yeah.
talked about fasting insulin. I want to talk about this specific test because I
Mhm.
know that going through your nurse practitioner or your primary care, this might not be something that even becomes a topic of conversation. So can you talk about what a fasting insulin test is and how it's different than like a fasting glucose or an HbA A1C?
Yeah, sure. So, a fasting glucose will tell us about the blood, the sugar content of your blood in that moment, right? And that's certainly helpful, but we need to kind of look at a bigger picture. So, hemoglobin A1C, that's another one that's on my list right away to
Hmm.
measure. That gives us an understanding of the blood sugar content in your body over a period of 3 months,
Hmm.
right? So that's even a little better than the fasting glucose, because then we're seeing how your blood sugar is trending over time. But what happens with insulin is when your body, you eat food, your blood glucose goes up. And then in a normal situation, then we have insulin coming from the pancreas. And insulin is a trigger to help us bring blood sugar into, for example, our muscle cells from our
Hmm.
bloodstream so that we can burn up that sugar as energy. That's what it's intended for, right?
Hmm.
So when we have a situation where, let's say, our glucose is elevated for long periods of time, then we have a lot of insulin in our bloodstream for a long time, and our cells become desensitized to the insulin. They're like, you're always hanging around here, there's no point for us to act like you're always here. And so then we get what's called insulin resistance.
Hmm.
And the problem with insulin resistance is it has so many effects on multi-system. But what I think happens in PCOS, it's the most visible, is it contributes to this hormonal dysregulation. So for example, insulin or hyperinsulinemia, meaning a lot of insulin in the bloodstream, can cause the theca cells in our ovary to get bigger. And the theca cells produce testosterone. So this is part of the reason, one of the reasons why we see an elevation in testosterone in our patients with PCOS, because those cells are just bigger and now we have more testosterone, and that has the effect of all these unwanted symptoms that we just really struggle with, the hair loss on the
Mhm.
head, but the increased
Mhm.
hair on the face, the menstrual cycle irregularities. Hyperinsulinemia can also upregulate an enzyme that's called aromatase. And aromatase irreversibly converts testosterone to estrogen.
Mhm.
So then we can also get estrogen excess, which,
Mhm.
can cause breast tenderness and increase risk for hormone dependent cancers and make our periods really heavy and really painful. And so patients will sometimes ask me like, well, how can I have elevated testosterone and elevated estrogen? That's not
Mhm.
fair. Don't I need to just pick one? And it's because we're making more testosterone, which gives us a bigger pool to aromatize and make even more estrogen. So gosh, isn't that just a
Yeah.
conundrum and a cycle? And even to add to that, the hyperinsulinemia can also upregulate inflammatory pathways. So then
Mhm.
we have more inflammation. The inflammation can also upregulate aromatase and turn our testosterone into estrogen. So it's like this whole vicious cycle of insulin and inflammation and hormones. So we have to get to the root of it. And the
Yeah.
root of it is really the insulin. So
Yeah.
how can we, number one, increase insulin sensitivity? That's going to be the root cause for so many people.
Right.
So to get back to your original question, the fasting insulin helps me understand to what degree hyperinsulinemia or insulin resistance is an issue for this patient, because honestly, some people will have pretty good insulin control. So then we have to go looking for what are the other metabolic drivers.
Right.
But I hope I'm making the case that if you don't have the fasting insulin, it's so difficult to understand what the root issue is for you personally.
That I feel like from just from my personal experience as well as, professional, is seeing this is like a super important, if I mean, I don't want to like say it's the most important because you have to have the whole picture, but this particular part really, especially if you are a woman who has PCOS and are overweight, or are, have those symptoms of insulin resistance, like weight around your middle, or these irregular cycles, high androgens. These things are, indicators that that insulin is a challenge somewhere, and getting on top of it now will help set you up for not only improving your fertility, but improve your health later on down the road, because now
Yes.
we have an increased risk of developing type 2 diabetes and stroke, and because of the hyperlipidemia and the things that contribute to that. So this is not just about getting pregnant. This is it, I mean, that is so important, but this condition, PCOS, it can be managed, and we can do that. But the sooner we can get that information, like where are we at in our insulin? Are we already at the pre-diabetic phase, or are we a little bit further back? Knowing that will determine how aggressively you treat it, and move from there. That's the information that you need. So I feel like I really wanted to kind of drive that point home, that the
Yeah.
fasting insulin is a huge part of it. So, um, what so when it comes to lifestyle choices and how we can support, I love continuing talking about this insulin piece. Like, what are some things that we can do right now to help improve this particular part of our the PCOX experience?
Yeah. So I'm a big believer in personalizing a treatment plan, but also keeping it simple, because life is complex and it's overwhelming and we have a million things to think about. So what can we do, simply? So number one, I'm going to call upon the collaborative care team. I think that this is a really important part where we can work with our colleagues who are dietitians, who are nutrition specialists, who
Mhm.
can really help to customize a food plan, because it's so easy for someone to Google and say, oh, I need to be low carbohydrate, right? Or I need to go gluten free, dairy free, or do all of these really restrictive diet plans.
Mhm.
And that's actually not true for everyone, right? It's about finding this balance that works for your body. So I would say to be very general, which, we can make some generalizations. I typically tell my patients we really want to focus on fiber rich foods. So fruits and veggies, those are generally going to be a good bet. With things like fruits or even, things like sweet potato that might be a little bit higher carbohydrate, I never say you can't have those foods, but
Right.
let's mix and match them with other foods that are going to slow the rate of digestion so that we can avoid big glucose spikes. So, no naked carbs. That's the rule, right? So if you want to have a
I
sweet
love that.
potato, great. Let's put some avocado on there. Let's have it with some greens and a vinaigrette that has some vinegar in it. That'll help with the blood sugar piece. If you want to have some fruit, that's great. Let's make it into a little charcuterie board. Let's have some sliced apples with some cheese and some almonds and some olives. There's always a way to enjoy the foods that we love the most, but just combining them.
Mm-hmm.
It's also really important that we're getting good healthy fats, so olive oil, avocado, even I'm even a fan of if you want to get some organic cheese, like I think that's great if you want to mix and match that with your fruits. Another cool trick that I really like if you're a big fan of, potatoes or sweet potatoes or some of the starchy vegetables is if you bake them or, roast them, steam them, however you want to cook them, and then allow them to cool to room temperature, the fiber inside them crystallizes in a different way that makes them less digestible. It becomes what's called a resistant starch, and then it has less effect on your blood sugar. So it's kind of a nice way to utilize leftovers. Like, oh, if I, cool off this potato and then make myself like a little potato salad, that's an excellent way to still have some of your favorite foods. The other piece is staying hydrated. When we're dehydrated, our blood sugar content is higher because it's
Yeah.
more concentrated. So general rule of thumb, half your body weight in ounces. So if you weigh 150 pounds, 75 ounces of water is going to be a good bet. And then also really simply walking after big meals, like 5-10 minutes walking, kind of activating the large muscles in your body. So helpful to keep blood sugar balance,
Mm-hmm.
blood sugar stable.
And bonus if you do that walking in nature, because now you have the stress reduction facet of it. And that's, I mean, that's such a huge component and something that I emphasize in when I speak to clients is that there's this aspect of our world is so stressful. We have
Yes.
so much on our plate. We have careers, we have our, relationships, plus you're going through the fertility challenges and body issues and all this stuff. So the stress component, like this really is the one of the things that you can do for yourself along with all of these things is reduce your stress. Go outside, breathe, take the time to walk around, smell the flowers, because this is your life now. This is where you're at right now, and this moment is how you find that peace, and it does wonders for reducing that stress, reducing the inflammation, and also sleep.
Yeah.
Get-
Yeah.
yeah.
All of that. And you make a really good point, and I just want to give a shout out. We have a new international expert guidelines in PCOS that just came
Yes.
out like
Oh
a
my
week
gosh,
ago.
it's amazing.
And there's a real emphasis on nutrition and lifestyle. But one piece that I was happy and surprised to see is that they even noted that in those with PCOS, there's they worded it strangely, a very high prevalence of psychological features, I think is what they called it. But really, that
Yes.
says to me, there is a mental health component to PCOS that we need to be aware of. And for a long time, no one recognized that. And so I think that's a really important part that you just brought up of finding peace and not ignoring that, yes, there's all this physical stuff going on and there's all the labs we could measure and all of the even lifestyle changes that we could make, but really we have to address that mental, emotional, spiritual component too. And it can't be ignored.
It cannot. It literally, we have to look at our whole multi-layered whole self person to see that this, maybe this condition is not just a physical thing. I mean, I truly believe in my own kind of personal philosophy, there is multi-layers to this. There
Yes.
is layers to your kind of childhood things and how you developed kind of, we're seeing this like perfectionist and kind of type A, very achieving personality, as well as like the mental health aspect and we're seeing the prevalence of depression and mental health and anxiety, which it's so interesting seeing this from a personal side, because I'm like, yep, 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 making all these checks, but there's coming into this and seeing, okay, I am a spiritual being, I am a physical being, I am an emotional being, I am a mental being. And seeing all of these components come together is really magical when that happens, because now you're able to care for your whole self. And when you start doing that, then it's like, I mean, it's kind of like dominoes when you start taking care of yourself, and not just physically, but this mental
Yeah.
health, mental capacity. And it's so, I was so happy when that came out, to see that this strong mental health component in it, as well as other changes that are so exciting, which we could talk about that for a whole nother conversation. Um,
Yeah.
so
Mhm.
I
But I'll
would
just
love,
say
oh,
really
go ahead,
quickly that on
please.
this mental, emotional, spiritual component, that when we when we're doing a PCOS treatment plan, it often requires us to make lifestyle and behavior change, right? That's just how it is.
Mhm.
There's, the exercise and the sleep and the stress and all the things we've talked about. And in order to make behavior change sustainable, we have to
Mhm.
connect to this meaning and purpose, the why, right? We have to anchor into what does it mean to me to make these changes? And I think
Yeah,
that really highlights the importance of going back to the collaborative care team. Like, is there a therapist or a
yes,
mental health professional that we can bring onto the team that can help you connect to why you want to make these changes and
yes,
how that translates into a future that you're excited about?
exactly.
So there's no shame in the mental health game. And I
No,
think making those referrals and putting together the team that you need to engage in your life is crucial.
I mean, is essential. It's vital to your whole well-being, because, again, at the end of the day, your care, yourself is what's important, because you are who you've got your whole life. This
Yeah.
is, you get this shot. And so
Yep.
I would love, kind of, now that we like kind of open this door of, talking about, kind of the spiritual mental aspect, I would love to kind of shift a little bit more personal.
Mhm.
And I talk about the kind of transformation of this, going from being this person with, um, I refer to it like your maiden aspect, this person before you have a child, to this mother aspect, and that transformation that happens in between that period. I know that you had some challenges, personally as well, throughout your fertility journey, your conception journey.
Mhm.
I'd love to hear about how um that affected you kind of on an emotional level, and how you overcame that, and I mean, now you're on this mission. So I know that's a part of that. So how did that process, that transformation for you, how did that change you as a person, and how do you incorporate that into your own life?
Yeah. So, my first daughter, my oldest daughter, she's almost 9 now. So I had my first baby when I was in the middle of med school.
Ah.
And that transition into motherhood, I think so many of us feel it was this new identity. And I remember, this is so silly, but I remember she was born and she was a couple weeks old and I was going to the grocery store for the first time by myself.
Mhm.
And I thought, wow, this is the first time I'm going to the grocery store as her mom. And I
Yeah,
just felt like a different person,
yeah,
right? And that transition, that birth of myself as a mother was so
yeah,
powerful to me that I realized at that point I was destined to specialize in fertility, because that was so important and special and meaningful to me that I just longed for that feeling for
yeah,
whoever wanted it,
yeah.
for whoever desired parenthood. I wanted that for them so bad. So after my first daughter was born, I have a nutrition degree and I'm in this naturopathic doctor program and I'm doing all the right things and I'm, you know, eating healthy and I'm exercising, and on paper it looks perfect. When my daughter was about 2, I had my first miscarriage.
Mm,
And it was shocking to me, right?
yeah,
Because here I am specializing in fertility, specializing in women's health. I'm doing all of
yeah,
the right things.
right.
And I think there's so much that can come up for us about why, and there's like shame and blame, and we can
Mhm.
go through this whole process and we never know why. We have to
Right.
release that. We have to come to
Let it
peace
go.
with it. And
Mhm.
I've realized now in reflection that if I was feeling that way, if I was feeling like the blame and the shame, even doing all the right things, how
Yeah,
easy it is for all of us to say, "Oh, was it, I ate that food, or lifted weights that day and was that too much, or I wasn't taking my vitamins as regularly. We can really go down this whole pathway of guessing, and it's
Yeah.
agonizing, and we have to
Hmm.
release it. Fortunately, my second daughter was born. I had pregnancy-induced hypertension during that pregnancy. Again, me, this healthy young person.
Right.
So all of that to say, it really taught me so much about showing ourselves grace,
Yeah.
about doing the pre-work to set ourselves up for health and success as much as possible, but then releasing the things that we can't control,
Yeah.
about building that collaborative care team of people who are going to be supportive of your choices and your goals, but also where you're at in your health right now.
Hmm.
And so now I'm able to bring this lens of the medical management piece, but also this personal aspect of my fertility journey when I'm working with patients, because it's more than just the lab results. It's
Yeah.
our lived experience, and it's our hopes and dreams. And it's really
Yeah.
complex.
It is. It's, I remember that day that I found out that I had PCOS, and it was like this stab of, like, inside of my soul. Like, somehow I felt so broken.
Mm.
I came from a family, I'm the oldest of 9. So, my mom has, had many children. And so, because I was the oldest and the first one who wanted to get pregnant, I just assumed, like so many of us do, that we're not going to have any problems,
Yeah.
and so you get thrown into this unknown of, like, I was in the military. I probably wasn't taking the best care of myself, but nothing could have prepared me for that kind of jolt. And like you said, like, you went through that, and that, like, shock of to your system. You're like, oh, this isn't how I thought it was going to be.
Yeah.
So
Yes.
when you get to that point, and I realized, and it took many years for me to realize, that those feelings stuck with me. They didn't go away. Even after I had Asen, my daughter, who is also, she just turned 9. So that's a fun age. But yeah, like, this transition to motherhood, like, I didn't realize how much those emotions of blame and shame and guilt all stuck around, and it impacted my ability to be a mom, honestly, for a while, until I started to see it, because I started diving into what, you know my body was doing. And after I quit nursing, like, all these symptoms pop back up. And so you have these things, these lived experiences that are, you can look at them one way. You can look at them as a difficulty, to, it is a challenge, or you can see it also as an opportunity to discover who you are, to
Yeah.
discover these parts that maybe you've been holding on to, that expectations, those things that we keep holding on to, that, and realize that it's okay for us to kind of take those burdens off, and see how much life we can live, and how much love we can live through, not only, like, love from other people, but love to ourselves. And that's,
To ourselves.
um,
Mhm.
as a parent, is so important. So, seeing and addressing this on the other side, and seeing that, maybe this is an opportunity here. It's different than, for those that are going through this difficult journey. It's different than what you expected, but it's also, it's both. It's difficult, and it's also
Both.
an opportunity. It's both. It is
Yeah.
not either or.
Exactly.
And if anybody tells you that, to dismiss the shame, or to, like, no, these things are real, and you're going through
Yeah.
it.
And I will say, a lot of times when patients come to me and they've struggled to conceive, this is the first health crisis they have had. This is
Yeah.
the
Hmm.
first time where something has happened that, they did the right things and the outcome wasn't what they expected. It is
Right.
shocking.
It is.
And we have to hold that, because for a lot of people, that is traumatic, and that trauma
Mhm.
is real.
Yes. Absolutely. It's not, and knowing, again, circling back to that mental health component that we know, that we're seeing emerging from our understandings as we learn more about, PCOS, is that that this trauma, I mean, the body holds it. It's not going away. And so it's, if you're going through that, maybe you just, as a listener, if you just hit that, like that wall, like, know that you're not alone. Know that this is something that we go through, and you can walk through this process with the right team, the right people on your side, because you don't have to do this by yourself. You don't.
Right.
And
Exactly.
that's why we're here. That's what we're here for. And that's so I think this has been an amazing conversation, and I'm sure it's one that we could continue forever. And so I just wanted to take a minute and talk to the listeners about what you are offering to them as a part of their as part of the summit. Yeah, let's talk about their free gift and what you're offering to them.
Sure. I'm so excited to have a lifestyle workbook. And this will really help everyone to do an audit of their current lifestyle factors and really supercharge their fertility potential by looking at nutrition, exercise, stress management, relationships,
Yes.
sleep. So it's not only kind of an inventory of the factors that I'm looking for, but also really actionable suggestions to help you to maximize your potential in those areas. I'm a lifestyle first type of doc. I think, supplements and prescriptions and all of that is absolutely valid, but we have to build this foundation. So the lifestyle workbook will really help everyone do that. And it's something that I include as part of my functional fertility blueprint program. So you'll kind of get a sneak peek of what it looks like to walk through the whole functional fertility approach.
That's excellent. And what an amazing gift and opportunity for our listeners to be able to do a little dive, see what these different aspects are in their life, and get ahead of moving in that right direction to looking at their whole health. And I know you have a big project coming up, right, here in the fall time. Yeah.
Exactly. Yes. So, as I mentioned, the Functional Fertility Blueprint is launching. This is a program that really helps patients to map out their own map of their body systems, which is incredibly empowering to understand how to create a hierarchy of their own unique individual needs. We walk through all the lifestyle factors. There's an opportunity to order your own labs and to have a lab interpretation, which is so helpful because not only do you see your report, but you know what it means and you know what to do with that information. We talk about preconception detox. We talk about sperm parameters and the men's health aspect as well. There's a mindfulness component. So it's really everything that I do with patients to walk them through a whole comprehensive approach to optimizing fertility.
That sounds like such an amazing opportunity. So if you, as a listener, if you are interested in getting to know Dr. Kalea Wattles a little bit more, you can find her on your podcast, on everywhere you can find Spotify. I know I find you on Spotify, but yeah, you can also get a hold of her through her website, which I'll have all those links here, and her social media as well. So thank you so much. I would love to just kind of ask one last thing that I've been asking everybody. So what's one thing you would say to a woman with PCOS trying to get pregnant that could bring her back to joy right now?
Wow, what a great question. Gosh, I think I would say that this is an opportunity, as we talked about, for you to create abundant health and longevity in your fertility in all of your body systems for pregnancy and beyond.
Yes.
Right. And I really am a proponent of focusing on cultivating health, abundant health.
Yeah.
Not just so that we can have a baby, but so that we can have the freedom, because to me, good health is freedom.
Yeah.
To have the freedom to enjoy that family and to enjoy what it feels like to be in our body. So not being discouraged, which is so easy to do, to feel
It is.
discouraged by a diagnosis, but just to remain consistent in the fact that we're not a diagnosis code. We are people.
We are.
And I treat people, not diagnosis codes, right? So this is an opportunity to take this information and to turn it in to this motivation to seek your wellness forever.
Absolutely. From here and from this moment onwards, this can
That's
be the
right.
start. This can be the beginning of a life, an abundant, healthy, whole life that you never even knew that you could have.
Yeah.
And that's so amazing. And I cannot tell you how much I appreciate you being here. And I'm so grateful to see you in this space, shining your light and helping people realize their dreams of a family. And um, so I appreciate everything, and it has been an absolute pleasure.
Thank you, Corey, for all you're doing, and your work is so important, and I'm grateful. Thank you so much.
Thank you.